Hi, this is Dr. Jen, fertility friend, talking to you from New Hope Fertility Center, and I'm here today to talk to you about PCOS and a patient of mine that I treated recently and how she presented. This was a woman around 30 years old, and she came in because she'd been trying to get pregnant for about a year. But during that year, she noticed her cycles were skipping around. She'd sometimes go every other month and not have a period for 60 days. And then sometimes they become regular again, and she'd get a period every month for a few months, so she thought everything was okay. She'd been having intercourse regularly and was just not getting pregnant, and it had already been a year. So luckily she came to see me, because if your periods are irregular like that, you definitely want to come in to see a fertility doctor sooner rather than later, because it can be a sign of a hormone imbalance. And sure enough, when she came in on her ultrasound, I saw this appearance of what's called a PCOS ovary, where we do an egg count on the ultrasound, and you see more than 12 eggs in one ovary, and that's a sign of PCOS. So right then I knew she had PCOS, because with the combination of irregular cycles and seeing more than 12 little follicles in her ovary, that is like a diagnosis of PCOS. She also described where sometimes she'd get some dark hairs that grow on her chin, or she felt like she had to wax frequently on her upper lip. This is because the testosterone levels, or male hormone levels, are a little higher in women with PCOS. Not high like a man, but just a little higher in women with PCOS. So what we did is we need to rebalance the hormone in women with PCOS and make sure they get their period every month, because that's going to give them the best chance to get pregnant. So we started a medication called letrozole, or Femara. She took the letrozole for 5 days. She came in and we saw a nice sized egg follicle on her ovary. She took an injection called Ovidrel, and then we did an insemination, or IUI, where her partner gives a sperm sample, we wash it, and we put the washed sperm into the uterus really close to the egg that we know is ovulating, because we gave the Ovidrel medication. So this treatment with the letrozole, the Ovidrel, and the IUI, with this treatment she was able to get pregnant, and I think it took her 2 months, and she got pregnant on the 2nd month of trying. And this had been after a year of trying on her own. Thank you for joining me today for this Dr. Jen Fertility Friend fertility tip. And if you have any questions, call in for a consultation or DM me on Instagram and I'll get right back to you.